So, so happy, Dr. Saunders, to have you here. If folks don't know who you are, this is Dr. Jason Saunders. He's I want to say naturopath. You are at heart. I will give you that. Definitely a chiropractor who has a passion and propensity for everything hyperbaric. I had the opportunity to meet Jason and his lovely wife, Melissa, another chiropractic physician, in person, finally at Metabolic Health Symposium last year, though we had been back and forth on a few emails and discussions then. But I want you to tell us a little bit about you, your practice, and then tell us a bit about what got you into hyperbaric medicine.
Sure, yeah. So happy to be here, Nasha. So thank you so much. We have our clinic in New Jersey. It's our main office, Core Therapies. And it's been Melissa and I this whole time, about 16 years or so. And we now have about 6 other chiropractors and massage and acupuncture, hyperbaric. We do a lot of nutritional work and functional medicine type stuff. So each doc has like their own specialty: neurology, sports medicine, prenatal, postpartum. You know, we try to cover a lot of bases with the different doctors that we have in the office. And over the years, you know, the functional medicine side has obviously, just like you would know, I mean, has grown tremendously. And a big part of that has been our incorporation of hyperbaric. We've been doing hyperbaric for about 12 or 13 years. It was initially an injury that I had. I blew a disc in my back, which is not good for a chiropractor, and not good for business, you know? So I blew a disc. I was putting a new roof on my house. I thought that was a good idea. So, and I was carrying, you know, squares of shingles up the ladder and everything. So anyway, you know, I was married to a chiropractor, so that was awesome. And she was working on me, and the back part of my issues, you know, probably resolved in about 2 weeks, 3 weeks. And I was back to work and doing my thing, but I was left with a right foot drop foot for about 18 months after that herniation. So I was already doing a lot of nutrition. I was taking supplements and like natural anti-inflammatories. I was eating well. I was getting muscle work. I was getting acupuncture. I was getting adjusted. Like these aren't foreign things to us. So we're doing everything we know, and everything was better except that neuropathy. And I was 26 or so at the time. So I was like, how is this? You know, we were doing triathlons and stuff. I was like, I don't even know. I can't even walk, let alone run. And I kind of started to just think that was like my story. And we were at a conference actually in Vegas of all places. And they had these chambers there. I had no idea what it was. I didn't know what it did. It just looked cool. So I said to the guy, I said, oh, are you doing sample sessions? I would love to try. So he puts me in there. I spend like 20, 30 minutes. I get out. And as I'm walking around the vendor hall, I start getting like pins and needles in my foot. I hadn't felt my foot in 18 months. And I was like, am I feeling that in my foot because of that thing I just did? So I went to go talk to the guy. Of course, he's like, oh yeah, for sure. That's exactly why, you know, and, but I wasn't sure. So we did, I think we did about 8 hours, 6 or 8 hours of therapy over the course of like 4 or 5 days. And I had left there with about 15% recovery in my foot. And so I bought one right off right out of the gate. I brought it home and I just treated myself. And in about 3 or 4 months, that was gone, never to come back. And I had no intention of using it as a tool in my office, let alone like building a whole, you know, structure and business around it. But, you know, it became one of those tools where we would do what we do. We would treat patients for whatever issues that they were coming in for. And those who didn't respond the way we needed them to, we would introduce hyperbaric. And almost every time we did that, we would get a positive response. And then I'm thinking, why am I still using this thing as like the last resort? You know, people are already coming to me as a last resort. And now I'm first using this tool as a last resort. It's just oxygen. It seems so simple and so safe. Why don't we start moving that up? And that's where we really started building sort of more protocols and strategies around hyperbaric and where it fits in the model of chronic inflammation, autoimmune disease, cancer, neurodegenerative, autism, CP, all these different kinds of things. And that's really when I started getting involved in more of the research around it and really trying to understand how and why it worked. You know, and then over the years, it's been great. We love it. It's a huge part of what we do. But in talking with a lot of colleagues, I was realizing that there was a like a hurdle, it seemed. People were interested, colleagues, my friends, that we would talk about it and they'd be like, yeah, but God, that just seems like that's really hard. Like or there's too much around that I don't know. Like it's out of my comfort zone. I don't want to get involved.
Well, I love it, because that's one of the things we wanted to have this conversation is, I think you just hit the nail on the head, that this seems like it's somehow out of reach for a general family practice or a specialty practice, or that it's like, oh, just another thing I'd have to learn and figure out. People have really made this, they've got a perceived belief system that this is very difficult, very challenging, very expensive, very unobtainable, a whole new thing they'd have to learn. Please tell us why this is not an obstacle to having your practice.
So what I didn't realize, I mean, it's like anything else. You're doing it all the time. It seems so simple to you and you don't even realize, and it took us years to develop that, but it was just in the background of everything else we were doing. And then I didn't realize like what that perception actually, was in the outside world. And really, honestly, so much of it comes down to just, I think, misunderstanding the tool, even just misinformation about the science of hyperbaric. There seem to be so many questions that would come up that even some of the initial ones, they're not even, they're relevant concerns, but it's like, it's based off a premise of not really how even the technology works. So it's like, once we understand a little bit more about how hyperbaric works and why, and then all the different tools that exist and which ones are more appropriate or not, based on, I always tell people we work with, there are a lot of options. And it's really just about, not that you have to choose them, it's what is your clientele? What are your patients like? What are your goals? If we understand who you're treating and what you're trying to get out of it, then we automatically start filing through different options and say, well, here's, you used to think you had 15, you have 2. And here's the pros and cons, and then on the implementation side, it's like, how do we talk about it? How do we schedule it? How do we implement it? Some doctors don't even want to have it in their clinic. They just want to have it, because they don't even have a brick and mortar, or they have a brick and mortar, but they also see all these people, virtually. So, then creating systems around how do we get chambers to people's houses, let them use it for 3 to 6 months or a year, and then send it somewhere else because they don't need it anymore. So, we just started looking at what are those sort of struggles, making sure that everybody's baseline education on the science of hyperbaric was accurate, and then understanding the different tools and how they work and why one is better than the other for whatever the application is. And then just creating simple strategies for implementation. And it's like, all of a sudden, docs just grab it and it's like, oh, that was so easy. Why didn't I do that 5 years ago?
And I love that, because I think that is, that's my own belief system. I'm comfortable sending people out for it, but I never had it in my own office for exactly those reasons. And so I kind of know my own. And first of all, we also had 2,200 square feet. We were cramming 12 practitioners and, 40, 50 patients a day through the office. There was physically no space for it. So there's the practical, but what would you say might be the top 2 or 3 sort of barriers that you hear over and over again from doctors? You kind of alluded to a few, but give us very specific, because I'm imagining you're going to speak exactly to the belief system as somebody else listening to this conversation.
So I think for sure, there are a few that come up often. And space is one. And sometimes that's just, sometimes we could work around that and sometimes we can't. But as you well know, there's different chambers. So some could be very large and some could be pretty small. So depending again on your patient base and what you're trying to accomplish, there are times where the 3 variables that we have to work with is how much pressure do we have? What percentage of oxygen are we using? And how much time do we have? And we can manipulate those 3 variables in so many different ways to create a variety of protocols that ultimately get virtually to the same place. So, soft chamber versus hard chamber, they're totally different animals. One is a very fixed pressure at a pretty mild amount. One has a huge variety of pressures. One, there's virtually very few, if any, contraindications or safety issues. The other one, you could hurt somebody and you really need to know more about it. But again, as long as you simplify that and know exactly where those lines are drawn, it's actually very easy to keep people safe inside. And so When space is an issue, sometimes going soft chamber versus hard chamber just makes more sense. It's still a therapy. You know, some people think, well, I hear this all the time still. Soft chamber doesn't do anything. That's just not true. I mean, I have like buckets of research in my office to say the opposite. You know, when we absorb oxygen, we absorb it because of pressure. Any increase in pressure is going to increase absorption. Is it as much pressure as a hard chamber? No, but is it more than you're getting right now? 100% yes. So, you know, so in space, sometimes we have to just choose different equipment, or we just create those sort of rental and purchase options so that patients can still get the tool without you necessarily having the space, let's say, in your clinic.
I love that you brought that up, because that's probably one I hear that a lot, of the space piece, myself included. So that's one of the things that, you know, I've gotten very recently to see two situations of someone who was able to purchase from you a large unit with more of the hard chamber type of option, with a lot of that more flexibility if they can, you know, mediate the pressure and time, et cetera. And then another who's basically renting a soft unit from you. So I love the options that are out there. Tell us about what you have for those doctors, which we have probably about 50% in our graduating classes are purely telemed. So let those folks know how they can use this tool in a practice that is a telemed practice.
Yeah. So for those folks, I mean, people, even patients, do put hard chambers in their homes. It's rare. They are definitely more expensive. They are definitely bigger. They're going to want some amount of help. It's not like that they could do it completely by themselves that easily, although they can, but it takes some time to learn. So that's like the exception, but a soft chamber in a home environment is very simple and safe. And, you know, we've created different programs where either patients who know this is something I need to do and I'm going to be doing it for a pretty long period of time, most likely purchasing that is going to be their best bet. And so we just have, you know, doctors refer those patients to us. We talk to them about what their issues are. We go through the same process. What's the goal? What are we trying to accomplish? Here are your options. And we just come up with a logical solution for them, you know, and you know this about me, like I'm never going to make a decision for the doctor. So the doctors are always going to be part of that conversation. It's important to me that nothing I say or do ever contradicts whatever the actual treating doctors, you know, saying or recommending. So, you know, it's always a collaborative effort in that regard. But so they could do that, or we tried to make it even easier to say, listen, we don't know if you're going to buy it or not. We don't really know how long you're going to use it. You certainly need it for 3 months or 4 months or whatever the case is. So here's a rental option. It's literally, as the doctor, you could have as little to do with that as you want. So, or as much. So in some cases, we have doctors who actually own 4 or 5 of these chambers and they rent them directly to their patient. And there's sort of for us, there's always a business model around it, as well as a patient protocol and patient care model around it. So we obviously want the patient to get the best result, and we want this to make sense for the doctors to be able to do it. And, you know, a healthy practice financially is a practice that will be around for a long time helping patients. So we always try to keep both of those, you know, factors in mind. So, or if you really you don't have space to hold them, your patients are nowhere near you, you don't really want to deal with shipping. So literally in those cases, those people could be just referred to us. We would have a dialogue between us, you, and the patient. We would literally just drop ship them equipment. They get videos on how to put them together. It takes 20, 30 minutes. Now it's, you know, it's together, and then either we help the patient develop a protocol or we help the doctor, you know, create that protocol. And then, you know, some doctors are very specific. They want all the information like that to come from them. That's great. So I'm happy to share that with them and they can deliver it. Or some people are like, you know what, I'm not ready for that. Can you just tell them what to do? Again, we keep this very flexible because the only thing that's important to us in this part of our practice is that, you know, doctors are able to get the effectiveness that they're trying to get and the patients get the results that they need. And so we created so many different versions of these stories because every doctor that we work with, every practice has its own version. So I just want it to be that the patient gets what they ultimately require and that the doctor is like, oh, that was easy. So we handle a majority of those interactions as much as you would want us to or not.
And I love that, because what we're trying to teach these doctors in general is terrain-centric medicine, metabolic-centric medicine, as well as very precise, precision, personalized medicine. And even the way you work with the protocol of hyperbaric fits that model. So tell us a little bit about how you personalize it specific to conditions. Maybe just a couple examples, not the whole gamut, because I know there's hundreds of ways to do this, but give us maybe the top three. And thinking about these doctors, most are focusing on cancer, but if there's others, I mean, there's a lot of things that go with cancer, right? A lot of comorbidities. So tell us maybe the top three conditions and how you might think about going about it for these doctors to be considering.
So yeah, there's a lot of pieces to that. But so a few things. One, again, it goes back to those variables. So sometimes we're using hyperbaric as a very specific metabolic tool, right? And the exact effect that hyperbaric is going to have with mitochondrial function, ATP production, and that whole bit. Kind of like what you said, sometimes we're very specific about a protocol and this tool for this purpose. And a lot of the people who end up using hyperbaric that use them longer term, they transition from, it's still just oxygen. It's not like I could put the oxygen in your elbow or your foot. It goes everywhere, right? So there might be a very specific protocol for this particular purpose, for this reason, because we have this problem. And then we kind of move that into more of a, how do we use oxygen as a more permanent tool for part of their recovery? I mean, I don't necessarily have any specific metabolic issue in this moment, and my neuropathy is gone. I still use my chamber in my house, probably 3 to 4 hours a week on a regular basis. So there's a place for it in a lot of the transitions of health as people, have different challenges or are just looking for different kinds of recovery. So, and then specifically in the cancer realm, as you know, so we might use it because, let's say we're doing dietary changes that are, we're shifting away from glucose metabolism and trying to upregulate fat metabolism. I mean, one of the cool things about hyperbaric is as you increase the level of oxygen in your body, you automatically increase your capacity for fat burning. And so if you did like a respiratory quotient, so you can measure like what percentage of your metabolism is coming from glucose versus from fat, you could see a shift in your respiratory quotient from going into a chamber. So right out of the gate, you could just see that there's this other effect. If I'm looking for fat burning, if I'm looking for a state of ketosis and I'm using oxygen as part of that therapy, it's a synergy between the diet and the oxygen to improve how much or how efficient we are at burning fat. So there's that part of it, the metabolic part. Then there's and then also, I guess, how that relates to, let's say, anaerobic cancer cells, right? So, obviously everyone here knows that like in traditional medicine, it's kind of like, we're going to kill everything, sort of, and just hope that enough of the healthy tissue and cells survive this process. Whereas we might be looking at this a little bit differently and saying, hey, is there a way that we can make unhealthy cells brutally uncomfortable while making healthy cells like thrive, right? And so a lot of those metabolic and dietary shifts and other supplements and things that we might use are all about that, right? It's, can we make this environment in our body as conducive to health as possible and, make it really difficult for unhealthy cells to live in that world. So again, oxygen is going to play a huge role in balancing that aerobic, anaerobic capacity. And then there's all the consequences of, a lot of our patients are maybe seeking our care, but they've already gone through traditional therapies. And so they've gone through rounds of chemo, they've gone through rounds of radiation, and now they have, consequences, we'll just leave it at that, from, that long-term therapy. So they have their neuropathies, they have their burns, they have their scar tissue, they have their digestive issues, they have, brain fog, they have all these, the list is long. So, all these consequences of the traditional therapy where they just need something that's going to help them heal faster than they're healing. And again, oxygen's going to play a role. It's, people hear when I lecture about hyperbaric, or even I'm sure other people, it's like, it almost sounds too good to be just like a cure-all. And it's not, and not at all. Hyperbaric doesn't actually fix anything. Our bodies do that work, But oxygen is a nutrient. That's what I try to teach people. It's not a drug, it's a nutrient. It's a vitamin, it's a cofactor. It's a very particular molecule that literally every single cell in our body requires to either produce the energy that it needs to do whatever job it's supposed to do, or to heal and recover, or to divide and replicate. So, if we're not getting enough of that, if we have tissue damage, if we have blood vessel damage, and we're not getting that, like, there's no other option but using a tool like this in order to get a therapeutic dosage of this nutrient to create a reservoir to allow the body to do what it does.
I love that. I think that I've heard that put before, just even through this recent conference you guys held. I heard a few people speak to that as some people did call it a drug, and like another pharmaceutical. I think it can behave that way. And we're going to talk about where I think maybe I'll put you on the spot a little bit about my questions around that. But I love that you talk about this as an essential nutrient. I mean, first, it's essential for everything, right? You don't live without oxygen. So I think that's really powerful to put it in our doctors' minds in that way, that this is just like we're prescribing, vitamin D or whatever. It's like, this is critical. And so many patients, cancer or not, are dealing with poor perfusion, hypoxia, all the pieces. I mean, this is why we're dealing with the COVID crisis and other things we're dealing with right now. It's about perfusion issues and all of the things that lead to poor perfusion, whether it's injury or trauma or stress or structural, or nutrient, being excessively, high in sugar creates hypoxia. I mean, all the things that lead to that, from the terrain to lead to this. This is just another tool to correct the terrain imbalances. And I love that you spoke to the fact that it creates, like you said, it kind of puts a little extra pressure and stress on the cells that shouldn't be there or shouldn't be behaving in a certain way. And it supports the vitality of the cells that should. So on that note, I know for personal experience, and I know from conferences and things I've learned, that you can also, just like you talked about, sort of the three variables that you're, dealing with: pressure, percentage of oxygen, and time. You can also have, like how we use vitamin C, for instance. Low doses is antioxidant, high doses are pro-oxidant. Can you speak to that sort of application in the hyperbaric world? Because I know there's a similar place. If you can push somebody into a pretty oxidative state pretty quickly, or you can kind of use it to sort of mitigate a hyperoxidative state. Can you speak to that differentiation?
So hormesis, is that a term we use? Okay. So, to some extent, everything that we do, even all the dietary work that we would use, it's all about, I think if there's one thing I've learned after all these years and, different things that I've studied and all, our bodies are designed to become as efficient as possible to do whatever we ask it to do. And so it's kind of like we've all seen an exercise where you start an exercise program, you get some results, and then you plateau. And so it became very apparent that if you don't keep changing your exercise on a regular basis, the body's going to get kind of lazy, really efficient, and you just stop benefiting from that the same way you would. But diet is the same way, right? If we don't metabolically shift people, and even if it's the right thing to do, it's not always the right thing to do forever. It's the right thing to do for this moment. And then we have to do something else for this moment and something else for this moment, because if we ever let the body get lazy, it will. And if it gets too efficient, it starts to not benefit from all these therapies that we're doing. And so again, hyperbarics got a role in that whole concept. Now, what I will say is I get a lot of questions about the oxidative stress of hyperbaric and, people's varying levels of fragility and how well they'll tolerate it. One of the big things when it goes back to sort of hormesis and, when the body is exposed to, let's say, mild or moderate hyperbaric, the real shift seems to be that we get a massive increase in SOD, superoxide dismutase. And so that's the response that I think you're describing a little bit, where like, here's a little bit of oxidation, but it's not breaking us down. It's not accumulating and like so overwhelming that we can't handle it, but it is enough to absolutely stimulate SOD production. And so that's one of the main short-term benefits that we see a lot in hyperbaric use is actually making them more capable of tolerating oxidative stress, because you're now upregulating your body's, strongest antioxidant. So I love that as part of it. But exactly what you're saying, I mean, you can take anything too far. So yeah, it's just oxygen. It's so safe. It's so wonderful. And if you have too much pressure and too much oxygen over too long of a period of time, there are definitely consequences to that. And again, it's all about knowing what those are, having an appreciation for where those lines are, and then knowing how to just stay well within them so that you're very therapeutic, but you're avoiding, consequences. Oxygen toxicity is a real event. There's,
yeah.
there's,
and before you go on that piece, because this is what's so perfect, the timing of this conversation is perfect, because one of the people that you were supporting to get a unit, they went back to basically their community and talked to their kind of local hyperbaric expert, who very quickly put them into oxygen toxicity. I mean, like, horrifying, as someone who's very vulnerable with a GBM, like very vulnerable state.
Yeah.
And we were freaking out. The doctor who you could, like, everyone was like, we were all here because you were guiding the process, and we were also into it, but he got sort of sucked into the web of a practitioner who claimed to be an expert when they clearly aren't. And what I think they were doing is, I think this doctor had no idea about the power of the device that this man opted for. He went for a hard chamber the whole bit. She had never worked with a hard chamber, yet she made all the clinical recommendations, and he listened to her because that was his primary. This is why this is such a good conversation, is that you and your team are so good at supporting the practitioner and the patient that none of us ever have to be in this position. You've done it again and again and again. And so one of the things I really want the doctors to hear is that take advantage of how you can support us in learning how to use this tool very effectively and safely, and to educate our other colleagues or our patients on doing so. So in that, I know, because I've talked to you and I've talked to Melissa, and I've seen how you guys express this to other doctors, because I talked to those doctors. You guys are so good at this. So how do you teach the doctor to watch for what the patient needs to be watching out for? Like, how do you teach the doctor to avert, say, an oxygen overdose?
So, I mean, again, maybe it's just me, and I just oversimplify everything. But I needed it easy for us. I needed it easy for our technicians. And so when I think things through like this, it's like, and then all of a sudden it's like, oh, okay, anybody could do this, because we've created a more or less like very obvious, goalposts, and we just have to stay, above this one and below this one, and we should be in good shape, And so we have a system, in place for that kind of thing. So, but to your point, like, if you talk to, if you go to like a wound care center where they're constantly, basically they run multi-place chambers often. So, 6, 10 people, 12 people in one chamber, everyone's going to 2.4 atmospheres. Everyone's getting 100% oxygen. On your first dive, you're just going all in, day one. And if you talk to the technicians, it's not if someone's going to have a seizure, it's when. And I'm like, I've been doing hyperbaric for 13 years. I've never, ever had a patient have a seizure in the chamber. What am I doing? What are they doing wrong? What am I doing right? Like, how is that even a thought process? And what I realized was, if you, here's like an average line of what, maybe half of the people are have a seizure, which is like, you've gone so far past what I would even consider oxygen toxicity that you're actually getting someone to seize. Okay. So we just basically, we have a rule, and our rule is we start really gentle and we build people up. Nobody goes day 1 to 2.4 atmospheres. We have a lot of patients, they've never even seen 2.4 atmospheres. Why would you need to do that if you can get the exact same result and benefit at some lower pressure, keeping everybody very safe, right? So,
wow. Thank you for that, by the way.
What's that?
Thank you for just saying just that. This is doesn't have to be complicated or scary. It just needs to be done thoughtfully, precisely, titered, individualized.
And even that specificity is very simple. We start here and everybody's okay here.
Yeah.
And then we just build and we find everybody's tolerance, just like you would with, you know, you're detoxing somebody, or you're going through, you know, some type of, you know, parasite issue or mold issue, or you don't just like throw everything you have at them. You're like, let's see how you tolerate. How well do you detox? How are your pathways? Are you, right? Like everybody's got their own journey. And if you just respect that fact and you know the rules, which are pretty simple rules, and you start here and you end wherever they need you to end, and you find that place well before you ever get to something dangerous, all of a sudden you've eliminated like all the real danger in hyperbaric is just strictly lack of education. And it's not like you need a PhD, you need a weekend. I need a weekend.
Yeah. Thank you for that too. Because I think that's the other obstacle. If you're like, the time into learning a new tool, you're like, I can teach you this over a weekend. I mean, the fact that you can send something to a patient's home, send them some videos, and your patient can learn it to some degree should be take a little burden off the doctor's shoulders. But this is exactly what I was hoping you'd speak to. Of when we all hear those horrifying stories, it makes everyone gun shy to want to go and do it. But you're like, wow, that would not be how anybody in this training program have been taught to address the patient in any form or fashion. As to your point, like mistletoe is a very good example. We're going to lose access to mistletoe in the United States because of a few doctors who literally saw a book and started giving it at the high dose. This is a titrated therapy that is patient dependent. The feedback of the patient's experience is what tells us how and when to titrate up. This would be very similar to me on how hyperbaric works. And so when you have someone hurt someone on a therapy that you know is otherwise regarded as incredibly safe and effective, they've destroyed it for all of us and potentially have it taken away from all of us. So, you know, I'm glad that you spoke to that piece. And, you know, one of the things I think that you also speak to that is so part of this, the culture, the ethos that we're building in this training program is that we treat people, we don't use protocols. Like it's very specific to that. Now, I love how you talk about it is when we say protocol, that is sort of like everyone gets this, like those 20 people in a chamber or whatever, right? But you're talking about guideposts. I think that's so elegant because it gives you room to kind of create your own protocol based on the patient, but it's not holding you or the patient to some particular way that it has to be. And that's how I think medicine fails us, is we try to cram everybody into that bell-shaped curve, and most of us are outliers. So to that point, when you think about like maybe share with us kind of in closing, I mean, your story is quite compelling of what brought you here. But maybe give us an example of a story that you've seen where hyperbaric enhanced, of course, the patient's quality of life and experience, but even another therapy. You alluded to a little bit with like ketogenic diet. We know there's a ton of research that is a beautiful synergistic combination. But can you kind of leave us with one that might compel the doctors to be like, I never thought about using it for this situation and this time, to just kind of help them understand the wide variety of applications that this is above and beyond treating cancer, supporting post-treatments of cancer, supporting or enhancing therapeutic outcomes with this. Give us a couple or one really juicy example that you've seen in your practice.
I mean, I'll give you a few because I do think, like I said, it's not that it's a cure-all at all. It's that it's this ingredient. And when you mix that ingredient with all the other things that we all do, that's where you start to see, you know, some of this magic occur. But my second patient was my stepdad, and he has MS. So, and he was probably 8 years into like a primary progressive MS going down fast. And I knew nothing at the time. Again, I mean, at least about hyperbaric, but you know, I was like, well, I had a neuropathy. This is a neuropathy. It's a completely different mechanism. It has nothing to do with my reasons or whatever, but like, here was nerve damage. Here's nerve damage. Let's try it. We did 40 90-minute sessions in 40 days. So every day, 7 days a week, 40 days in a row, 90 minutes. He started walking again. He got the feeling back in his feet. He got normalization of the color in his feet. The swelling in his legs went down. He started doing stairs again, like insane in that period of time, where they actually changed it to relapsing remitting because you couldn't have that response any other way. Our third patient was a friend of mine's mom who had a stroke, and she was an older woman, and you know she just wanted to read. She couldn't, she lost a lot of her vision. She couldn't read. She ends up getting enough vision not only to read, she gets her driver's license back. So that was so it was me, my stepdad, and then this woman. And I was like,
you could not have been gifted more. Like God sort of was like, here you go, little draw. Let's just, here you go. Here's your path and purpose, my friend.
Yeah. I was like, how is this thing? How did that do that makes no sense to me. That's when I was like, I need to understand this at some crazy level. But we see, that's the kind of stuff like, we've had at least a dozen kids, on the spectrum, like say their first few words in our office after some sessions, we've seen multiple post-stroke patients get their licenses back once they get neurologically sound again. Like just a couple like Melissa, if you don't know her story, but she had a really terrible neurologic Lyme case. Our office is, I don't know if it's 2 miles from our house. She'd have to call me for directions home. Wow. And like Hyperbaric played an enormous role in that recovery of her brain. Like to see a lot of these, we're in the Northeast, we have a ton of Lyme patients.
Oh my gosh.
There's not a lot of research currently on hyperbaric and Lyme, very little, but it's become like a primary part of our plan for people because the effect that it has on that inflammation healing, especially the neurologic pieces of this, it's incredible.
And to that point, because so many of our cancer patients do have a lot of co-infections, do you see, because I've also had feedback from patients and practitioners that doing too much too fast, yet again, of hyperbaric could have too much and too fast of a die-off. So I'm assuming you take that low, slow approach in this population as well, just like anything.
With across the board, I have not found a reason not to do that. People are in a rush. Everyone's in a rush. Every patient's in a rush. The doctors who refer to our clinic for treatment, this is my protocol. I'm like, well, listen, I start here. I'll get there. If the patient will let me get there, I'll get there. But this is where I start.
Oh, I love it.
Why am I going to expose somebody? Yes, it's safe. It's just oxygen, but it has consequences. And why do I want to, if I'm going to find that line, let me find it. Not let me blow past it and then try to figure out how to get back. That's not how we treat people. So.
And I know one of the pieces that it's being well researched, in fact, just got a lovely write-up, I think in Sloan Kettering or one of the New York big universities, was its post-COVID syndrome, like the sequela to what's happening there. Have you guys seen or worked with any of that? Because I think that there's a lot of similarities to the terrain of someone from a co-infection or a cancer process or an overzealous oxidative cytokine storm process that I would imagine this would play a lovely role in supporting.
You see, the list of, comorbidities that make COVID a problem. And you're like, this person COVID's not their only problem. They're heading down a very specific road, metabolically, inflammation, all this stuff. So, so we're doing, there's plenty of reason to use it for COVID itself, but that's like a whole different animal. But for post-COVID recovery, because there's so many issues that are, rebalancing of the cytokines after that entire inflammatory response, healing of the lung tissue, healing of the vascular system. The mechanisms of hyperbaric are very few. There's about 10 or 12 very well documented mechanisms that this is what happens to every human that goes in this thing. But the benefits of how those 10 or 12 mechanisms show up in people's lives, depending on what their issues are, that's kind of the broader base of how we see it help so many different people. But we've had quite a few, especially like the loss of smell and taste. It's all like neurologic stuff, right? So these things respond really well to hyperbaric.
Love it. And so how do doctors find, where would they get started? If they're like, okay, I'm interested in having this in my practice, or owning some of these and renting them out from my practice, or sending them directly to my patient, where do you recommend they start? How do they reach out to you and Melissa? Where do they begin in this process?
So our main website for that stuff is HBOT USA, HBOTUSA.com. So there's a ton of information on there. We have a YouTube channel. I think I have 80 videos on all different topics, research or testimonials or just general conversations about hyperbaric mechanism, how it works, how to calculate the dose of hyperbaric. Again, our whole thing is once you know how safe it is and basically how simple it is and how that can all be implemented, whether you're a patient at home or a doctor trying to use it in your clinic, we're trying to remove those barriers because there's just not enough clinics. There's just not enough places for people to get this therapy. So whether you get the equipment from me or get training from me or any of that, it doesn't really matter that much to me. I'm happy to help. I love to help people because I'm passionate about it, but I just want more clinics and more chambers and more access to this stuff. So, we're just throwing out all kinds of free content and education because I know when those barriers are dissolved, the access, increases. And so the YouTube channel is a great place to learn a ton of stuff. And then on hbotusa.com, there's a kind of like a patient page and a doctor page. And then there's a way that you could basically just jump on my schedule. Cool. So if somebody wants, you just click a link, my schedule shows up, and you just throw yourself in a 30-minute spot. We could just chat about, what are you thinking? What goals do you have? Or do you want equipment? Do you not want equipment? Cool. What kind of equipment is best for you? So, we just have time dedicated for those conversations.
And when this gets posted on our forum, I know a couple doctors who've spoken to you directly. I know that they'll give their 2 cents back in that experience, but it's been very positive, from both the doctors who've consulted with you as well as the patients. Feedback outside of the patient who had the rogue doctor who kind of took over the case, but that was not your issue. You're like, like that must be maddening. Like I said, it's like when I hear the story, because, like HBOT's your jam, mistletoe's mine. And when I hear bad reactions, like, how do you screw that up? It's like, whoa, but you do. So I'm really happy for this, but you guys are amazing. I mean, you are so generous with your time, your energy, your knowledge, your hearts, your souls. I'm really grateful that you took this time with us to let us know a little bit more and help break down those perceived obstacles that really aren't obstacles. And so I think hopefully you'll hear from a few of these folks. To your point, I would also like to see these chambers make their way around the country and beyond. We've got physicians all over the world now being trained in this. So Dr. Jason, thank you for your time today.
Of course, my pleasure. Again, just so happy to share. So.
Yeah. And aloha, they're tell them a little bit what you're up to right now. I think this is great. Like show where Hyperbaric is doing its magic abroad or in another place.
So one of the organizations that I lecture for is the International Hyperbaric Association. Yeah. So it grew bigger than this, but it started out as the World Surf League, which was like all the surfers. This was like the pipeline at North Shore Oahu. It's like the World Series of Surfing. So
exactly.
Like, we need the World Surf League asked, hey, we want somebody to come and treat the athletes. So Melissa and I, we already we homeschool our kids and we bop around quite a bit anyway, never for such a long period of time. But so we 6 weeks in Oahu and, we started treating athletes and then a couple of their friends and then a bunch of the lifeguards. And then we actually got connected with there's a huge need for, there's a huge autism chapter in Oahu and Honolulu. Wow. I had no idea. And so somehow they found out that we were here. They had all heard Hyperbaric may help with autism. So they reached out. We've treated a bunch of the families now with a few kids. We're actually, the IHA is going to donate a chamber to the chapter leader of that group so that she has 4 kids, 2 of which are on the spectrum. So she could treat her family. And then we're going to see if we can kind of help. They have for your doctors, I don't know if you guys do other stuff outside of, specifically, but, they don't have a lot of help on those islands. And so, they're happy to get any access to any kind of therapy or help that they can. So it's been great because it's been a chance, exposing people to this. Some were familiar, but just curious, some have never even seen or heard. And, the response has been tremendous. So it's been a really cool opportunity.
I love it. I love that you guys get a little aloha energy and it's such a reciprocal. That's what I think is so powerful of how much you guys give. It's so beautiful to see you receive in it as well.
Wondering how long can you live here and just treat people for free and have them come over and live on the ocean? Is that something that we can just make that happen?
Yeah. Well, I spent seven months of my year on a tropical environment on a big water thing. And it works. We get creative with you here. My New Jersey boy here, heading out to the shore, North Shore every winter. Not too shabby.
I can get used to that, I think.
I love it. You guys are amazing. Well, thank you so much. We'll make sure we have all the links that you shared to your YouTube, to the HBOT USA, to all of those pieces so folks can find you, track you down, start to learn, start to educate, start to remove those obstacles and get this going. either in person or, sent off to the patient. So again, thank you. Blessings to both you and Melissa and your lovely family.
Thank you so much.
We'll talk soon.
Yes, we will.